I am here with Dr. T, who is a world famous podiatrist right here in beautiful Aptos, so you don't even have to travel far to see her.
Pacific Point Podiatry.
Pacific Point Podiatry.
Now in Aptos.
Like, have you always liked feet? Like, it seems kind of like a gross subject.
Yeah. No, I can't say I've always liked feet, and I don't even know if I like them now.
Why are you treating people's feet then?
Well, because we underappreciate our feet. So I was a dancer in high school, and I saw what could be if your feet didn't work. And then the further I got into this specialty, the more problems I saw. Things like club foot, diabetic foot ulcers, people who want to be active, but they can't because their feet hurts. That sucks.
Yeah, that does.
So I think I fell into it accidentally, and then this whole world unveiled itself. And now I'm seeing people, I do amputations, and I'm like, how do I not do these so often? So I got to learning about foot biomechanics, why people have pain, why people wear high heels, what the long-term consequences are. And then I started to look at the foot in a more holistic approach. How can I get people to care about their feet so that they don't lose it? So that's how I kind of stumbled into it. It really became a public health issue. Why was I doing so many amputations? And it was because people didn't have basic foot hygiene knowledge.
Wow. How many amputations have you done?
Well over 500.
Seriously?
You don't count after you do so many, or you're just like, this is just part of my resume now.
Where were you working? Like, why were there so many people?
I did my training in Michigan.
Okay.
And Texas. So my fellowship was predominantly limb preservation. It was people who had diabetes, maybe diagnosed or misdiagnosed or underdiagnosed because they didn't have access to a medical doctor. And they would start off with something like a blister or a callus. They stepped on something, but they didn't feel it. It got infected. They ended up in the emergency room, and they would call my team, the wound care specialist team. And that's when I got to discover sometimes people just don't know that there's something wrong with their foot. They think that what they have has always been normal for them until they start to feel really sick, or they're bleeding. There's this blood stain on the sock and they didn't know it because they didn't feel it. So that's kind of how I got into the world of limb protection, preservation, limb salvage, however you want to call it. That's how I got to learn to appreciate feet a lot more when I started to have to take them off to really save the person's life from the infection spreading or losing their leg or even higher.
Wow, that's a trip. So how did you shift from amputation to is more of the education and care before amputation is needed? So how did you kind of shift gears and start doing that side of the business?
It was always a whole spectrum. When I did do the amputation, they would ask, how did I get here? Well, it starts off with recognizing that you have a foot problem, or that you have diabetes, a circulation problem, maybe peripheral neuropathy, something that needed to be monitored by a specialist. And it was just a gradual transgression on education. Every appointment I would have with the patient, as I'm changing their dressing, or I'm looking at other deformities that are developing because of one amputation. The one amputation doesn't stop there. Other parts of your body starts to adapt and can create new problems for that individual. So it was very natural to talk about what can we do next to prevent this from happening again, because we've got 2 feet. So if it's going to happen to one foot, you're going to increase the chances of problems on the other foot. So I already had that opportunity to speak to people about prevention. And then I started to pull out of that chronic care because I knew that I can capture patients sooner with education. And here in Santa Cruz, people are very proactive. They are very preventive, and they want to look for holistic approaches to foot care. And so I started to push my practice in that direction because I saw that that was a huge gap in medical care, and most of it wasn't covered by insurance anyway. So that's how I started to lean into holistic podiatry.
Can you elaborate on holistic podiatry?
Holistic podiatry is a general term. So the term holistic, what does that mean? It just means that we're looking at the person overall, from their mental well-being, their social status beyond what we see on an x-ray or an MRI or even the lab results. So we're not honed in on just the symptoms, we're looking at the individual. Can this individual undergo a surgery and heal it successfully?
Mm-hmm.
Or are they better off at a care facility? Or would this be so detrimental that it's not even worth considering? So that's the holistic viewpoint that I take with people who have foot problems in trying to prevent the foot problems from getting worse.
Do you have a favorite foot issue that you treat?
Yes.
What?
Too many.
What do you mean too many?
Too many.
Too many feet? Too many problems?
My most favorite foot problem really is pain at the ball of the foot.
Uh-huh.
Because it's underappreciated. And oftentimes I get patients coming here for a second opinion because there was a misdiagnosis of something called fat pad atrophy. And that's when your fat pad in your foot shrinks or shifts because of age, or that's just the anatomy of the foot. So that is my favorite pathology to fix because it no longer needs to be surgery, where I have to do surgical correction to realign bone pressure points. But really I can do something that I shared with you before, was a foot filler, where we use various types of injections to increase internal cushion versus wearing custom orthotics that we put inside shoes. And most people here like to be in sandals. They like to have open toes. They like to wear dress shoes. They like to wear, very stylish shoes for their jobs.
Mm-hmm.
So by adapting to what the people's needs are,
Mm-hmm.
instead of telling them they need surgery, it's black and white that you need this thing, we have alternatives to that. And so the injection is a really innovative tool that I get to offer to patients.
That's cool. How long does it last, the foot injection?
There's a couple of different types of injections that can range from 6 months to 18 months, and it depends on the person's age, their ability to tolerate that product, how quickly it gets metabolized, and how much they're on their feet.
Very cool. And what would you say your least favorite thing to treat or about this job is?
My least favorite thing, which I have already gotten rid of, is treating the insurance companies.
Oh.
Not the people.
Yeah. Okay.
Punchline.
Fair enough.
The insurance companies, there's value to having it, catastrophic accidents, but when it comes to preventive care, routine care, it's a lot more restrictive. Patients don't get immediate access to their doctors without permission, without going through the red tapes of the insurance stuff. So it just made it really hard for patients to access me, especially people who need it, people like diabetes or circulation problems. So I kind of just wiped it out, and it is, if you need me, I'm here. No restrictions.
That's great. Did you know that you wanted to be a doctor from very young, or was that just something that you kind of fell into?
That was an accident.
It was?
I had no intention of becoming a doctor. I went to undergrad thinking that I was just going to get the degree and work somewhere. So I worked.
What do you mean, get like a
bachelor's, like a undergrad degree?
Oh, okay.
And
I thought you meant like get your doctorate and then be like, all right, that's good. I think I'll just stay home now.
Yeah, right. That was the same thing. I got my medical degree and I was like, cool. Does the job just kind of
fall into my lap,
come my way, or like?
Yeah, did it?
And weird stuff came along, and I was like, I did not expect a lot of that. And then I kind of just got guided to wonder, to one thing to another. I went to undergrad and I said that wasn't enough. I went to podiatry school. That wasn't enough. I went to do my fellowship. That wasn't enough.
Like you weren't satisfied. What do you mean it wasn't enough?
It wasn't enough. It just it wasn't fulfilling.
Yeah. Okay.
And then I opened my own practice and I was like, whoa, how did I get here?
And now this feels like
this is way fun.
You love it.
So much more intimate. It's so much easier to be with the patient and their families and their friends and really get to understand the entire dynamics of the person.
Yeah.
And how they came to need foot care.
Yeah.
I do want to share that I'm board certified in minimally invasive foot surgery, which means I'm the only one in the Santa Cruz County and Monterey County to offer minimally invasive surgery right in the office. So traditional foot surgery, we take it to the surgery center or the hospital, and that is a really great option for care. But an alternate to that, for people who don't want to be at those facilities, they don't want to undergo anesthesia, they want something quick and efficient at an expert level, I just do that all in the office. It's totally convenient. the price is transparent. People know exactly what they're paying for.
Mm-hmm.
They're not going to get a sudden surprise bill 9 months from now from the
Yeah.
service. So it's just clear care.
Yeah.
And I'm really happy to be able to offer that. And I don't think anyone else has been offering that in the entire community.
That's great.
Forever, really.
Yeah, that's great.
So the top things I recommend for foot care, which I'm trying to like shuffle through in priority. So foot care is undervalued. It really is. So it really comes down to the very easy thing we can do is, number one, pay attention to our feet. What shoes are we choosing for the activity we want to do? Are we choosing flip-flops to play volleyball or basketball? That's a bad idea. Are we choosing Converse shoes to go on a hike or running? That's probably most of us. Also a bad idea. So really choosing the right type of shoe for the activity that you want to do is super important. And that's number one. Number two, when you pay attention to your feet, notice anything that's changed. Maybe your toes are starting to change shape, like they're hammering, or you've got a little bump, which is a bunion, or maybe you've got some growths, some extra moles that weren't there before. Just knowing what your own anatomy looks like can help guide you on when it's a problem. Some people have skin cancer under the nail, but they don't know it because they're not looking. They don't know what to look for. So just a general screening, either by yourself or going to a professional to do it. So you have a baseline. So the baseline, knowing your body. Number three, when you take a shower, make sure your feet are dry before putting on a pair of socks. Because if your feet are kind of moist, kind of wet, and you put on a sock, you're just trapping that moisture, and that's how you can get athlete's foot and cracks between the skin, and your feet can get really weird. And then your nails can get really funky. So that's the top three things that I can think of to have healthy, happy feet. Three is simple. We can all do it every day. And some people need assistance. So having a partner or somebody else, a caretaker, do a quick evaluation on the top, on the bottom, and in between the toes, just to make sure there's no extra growth or things that get trapped in between, or even a Lego stuck on the bottom of your foot.
Does that happen?
That happens. Any calluses that show up needs to be evaluated.
Okay.
Heel pain,
Ankle
sprain, ingrown toenail fungus, weird stuff that grows on your foot, your toes are just looking weird, maybe a previous surgery that didn't have optimal outcomes.
Fat injections.
If you feel like your foot just needs a little bit more cushion because you're wearing high heels, that is a really great option, I have to say.
I'm going to do that when I'm ready.
Yeah.
But you said that mine are good for now.
Yeah. I love finding solutions for what people are unwilling to give up.
Yeah.
Because it's practical, right?
Yeah. Yeah.
Like, I know people like dress shoes. I get it. So I have solutions for that.
What is a hammer toe?
Hammer toe. This is your foot.
Yeah.
When your toes bend, that's a hammer because it's hammering on the ground.
Oh, like they can't go straight, flat?
Yeah.
How do they get that way?
They curl for a lot of reasons. Some people wear shoes that don't fit the length of their foot, so they're crowding their toes. Some people have a bunion where it pushes on the other toes so that those toes don't know what to do, so they start to curl up. Some people have medical conditions that causes the nerves to act kind of funny, so the muscle get imbalanced and then that can bend it. That can happen in people who have stroke, circulation problems, diabetes, and so on, rheumatoid arthritis. So a lot of reasons for hammer toe. And when we're older, I guess back in the day, they were never really given options to correct a hammer toe other than major surgery, which required a surgery center, anesthesia, and all the stuff, pins and needles and stuff. But now I treat these right here in this chair. I've treated hundreds of people with hammer toe deformities with the smallest incision under local anesthesia to get that straightened. When a hammer toe gets ignored, a couple things can happen. You're walking on the wrong side of your nail, so it hurts, or the nail pops off, or you can get bruising or callousing, thickness of the skin, or it can create an open sore and an infection happens and an amputation becomes a problem. So straightening those out, really nice thing to do, very easy to do. And I actually love doing that procedure for our older population because it's a minor procedure versus what we used to do was major reconstruction that required a pin sticking out of the toe, cutting the joint, straightening it out, that's still a great option. But I think most people prefer just something really minimally invasive, no downtime. You can stay independent. I'm actually getting one.
You are?
Yeah.
So what are you going to do about it?
I guess I have to do surgery on myself.
Are you serious?
I hope not.
Wait, you can't do that.
I can't?
I mean, won't you?
I can reach.
Are you serious?
I don't know. We're not there yet.
Okay.
Maybe if I'm older.
I don't think that I could cut myself.
Well, no one else does it here, so I don't know who I would
trust. You trust yourself, but do you think you could pull your foot and numb it?
I think I can.
You could
I'm
put
not
an
saying it's
incision
a dare. I'm not saying
no,
that.
Yeah, no, I'm not daring you.
I think I can figure it out.
Okay. If you need treatment or solutions for any of those things or anything else, Dr. T's your gal.
I'm really good at second opinions.
At Pacific Point Podiatry.
Yes. You got it. You can find me here, Pacific Point Podiatry, off the Rio Del Mar exit.
Yeah, perfect.
And your feet just gets really weird after a day of socks without air.
I take my socks off. Listen to me.
Your feet look really great, though.
Did you know that? Thank you. I'm so grossed out by anything